am Dr. Brinda Chennappa. I'm an obstetrician and gynecologist. I am working at Manipal Hospital, Jayanagar, Bangalore. Today I've picked the topic of pregnancy and weight gain. This is a very common topic that people come up to me as soon as they are pregnant. They come and ask at their first consultation about their weight and what should it be and how much should they gain and where do they go from here. For me, weight is not an issue that you should only address when you are pregnant. It is an issue that you should be looking at before you get pregnant. Everybody needs to be healthy, whether it is the pregnant woman, the husband, mother, mother-in-law, father, father-in-law, children, babies. Everybody has to be healthy. The latest problem in our society is we are all getting to be very overweight. Overweight, obesity is the new evil. It causes a lot of health hazards. You've all heard multiple times about diabetes and blood pressure and high cholesterol, liver problems, gallbladder stones, cancers. Everything, if you start thinking about it, comes back down to obesity and gets a link with obesity and the diet that we are eating today. So I think obesity is something, weight is something that we need to address. I'm talking about the urban population here. Of course, in the rural population, we have the underweight patients. They are barely 35 kgs at the start of pregnancy. They're about 40, 43 kgs by the time they deliver. They deliver tiny, tiny babies which are malnourished, undernourished, and that is not good either. So we don't want to be at either end of the spectrum. Somewhere middle ground is a happy medium to go through. Now, the normal weight for a pregnant person, what we call as a BMI, I think if you look up Google, you will be able to find your BMI, and you need to be in the correct BMI for your weight. The higher your BMI, the less weight you should be gaining in pregnancy. If your weight is already more for your height, then let's be realistic here. We all have a food-related issue. Most of us. We have got multiple cuisines to eat from, multiple food habits, different tastes, and we want to eat and we want to enjoy our lives. But at the same time, let that enjoyment go on for long and not stop quickly is the aim of this talk today. Now, what happens if you gain too much weight when you're pregnant? Why the worry about weight in pregnancy? Weight in pregnancy causes diabetes in pregnancy. Of course, it's also linked to whether you have family history of diabetes and there's genetics of diabetes in you. As a race, as an Indian race, as an Asian race, we are prone to diabetes. Although you may not see it in your parents, there may be uncles, aunts, grandparents who have diabetes, and they're all your relatives. So please be aware that gaining weight simply because parents don't have diabetes is not necessarily right. And the more weight you gain, more the problems of pregnancy as well. We can have high blood pressure in pregnancy, we can develop diabetes in pregnancy, bigger weight. Mothers have been shown to have bigger babies. Bigger babies means difficult deliveries. If you try for a normal, things may get difficult at the end of the delivery and you may land up with vacuum and forceps delivery. Or if it is too big, you will land up with a cesarean. So these are things which is best avoided by eating a healthy diet. Now, diet alone is not enough. I come to the next topic, which is, weight and exercise are two parts of the same issue. So most of us, again, frequent question, doctor, this month what exercise should I do? Next 3 months what exercise should I do? Now I'm close to delivery, what exercise should I do? There is no such particular exercise that anybody should do or not do. As long as it is safe for you and you're not taking any risks for whilst doing the exercise, it should be fine. It depends on your fitness. So the rule is whatever exercise you did before you got pregnant, generally speaking, you can continue that throughout the pregnancy and there is no reason to stop as long as your body allows you to do it. You do have to listen to your body. If it says I'm tired, I can't do it, you need to stop at that time. So relax and try again after a few days. That's important. Again, the common fad, first 3 months, doctor, should I not be on bed rest because I will have a miscarriage? Unfortunately, miscarriages do happen. It's the norm in the first trimester. If all pregnancies went to term, we would have a lot of babies which were not normal, which were being born. So the most common cause is not us walking around and doing our daily chores. It's because something was not right with the pregnancy. So to say that bed rest or something you ate or something you didn't do or something the doctor didn't give or whatever it may be is wrong. That's the way of life and we need to accept that. So another favorite question of my patients is, what food can I eat, doctor? What should I be eating now? There is no such food which is bad or good. Of course, it depends on what is going on with your well-being, how well and fit you are. Generally, everybody needs to eat a balanced diet. We talk about 5 fruits and vegetables a day, and I don't mean 5 fruits and no vegetables a day, which is another common thing. People think eating lots of fruits is healthy. It isn't. You need to have a lot of vegetables. Maybe 1 or 2 fruits a day is a good idea. That's if you're not already diabetic. If you have any specific dietary requirements, adjustments that need to be done, I would suggest you keep a log of what you're eating for a few days and go and meet a dietitian, because as a doctor, it is difficult for us to give you a so-called a diet plan, because a Caucasian diet plan with meat, with no spice is not something that you will like, and I cannot say to a North Indian, go and eat ragi mudde. So it just doesn't work like that. Please meet a dietitian if you want a specific plan. But generally you need to have vegetables, proteins, greens, and some carbs and some fat. So sticking to a healthy diet plan is a good idea. The same goes with after delivery as well. Most people that I have put on a diet during the pregnancy because I didn't want them to gain weight tend to land up eating after the delivery and gaining more weight than they did during the whole pregnancy. That again is not such a great idea. I understand if you're in 45 kgs or 43 kgs at the end of delivery, you do need extra calories that we all had to eat when we were pregnant a long time ago, because we were undernourished. And maybe the same holds good for people in the rural areas who are undernourished. They need extra calories to feed their babies because they don't have the extra fat that they have gained in the pregnancy to lose. So post-delivery, the idea is to get rid of the fat, not to eat excess, especially a carbohydrate-rich food, which is going to give you a whole lot of extra calories. And then you put on weight. Imagine all the weight that you need to lose afterwards. It certainly is not healthy to be that way. And the idea of trying to talk to you today about weight so much is because pregnancy doesn't end a woman's life. Pregnancy is just the start. You have a long way to go. And please remember, there is another 20, 30 years ahead. When you fast forward your life, you don't want to be looking at diabetes, blood pressure, knee problem, hip problem, can't walk, can't sit, chest pain, and the list goes on. So this is the whole idea, to control the weight during the pregnancy, after the delivery, so you don't become overweight mothers, give birth to overweight babies. Overweight babies have been found to become overweight teenagers, and that cycle continues into the next generation. I think as Indians, we should stop eating very high carb-rich diet, which we do in South India, and focus on having more of a balanced meal. And how you come about that balanced meal depends on what you eat on an everyday basis, and there is a dietitian who will be able to guide you that way.